I am Dr. Banshi Saboo, Diabetologist at Ahmedabad. I am the one who is using a lot of sensors and pumps in my diabetic patients. I have type 1 clinic, dedicated type 1 clinic, as well as we also use the pumps and sensor for our type 2 diabetic patients. Many times and many physicians, they feel that many of their type 1 patients are not very affording, how they can afford a type 1 patients, how they can afford insulin pump or sensor, which are really very costly. But I always talk to my physician friends and pediatrician that using a technology in a type 1 patients actually improves the quality of life. But here not only it improves the quality of life, it also improves the quantity of life. We are not seeing many adult type 1 who had developed type 1 disease before 15 years, 20 years, 30 years, 40 years, because most of them, they die. I always talk that DCCT is a trial which had shown that a tight glycemic control definitely decreases the complication in type 1 diabetes, but that is not true for type 2 diabetes. That means we have a definitive evidence to achieve a tight glycemic control in our type 1 diabetic patients, while in type 2 diabetic patients, even after achieving a tight glycemic control, many of our diabetic patients, they develop complications, because all the complications are not just related to the glycemic control, they are multifactorial. So in a type 1, I would like to achieve a very tight glycemic control, and that cannot be achieved just by using a 2 shots of a premixed insulin. It has to be a basal bolus therapy, 3 to 4 shots in a day, and it really becomes very inconvenient for many of our type 1 diabetic patients. If they can afford, I suggest them they should be on insulin pump therapy. But insulin pump therapy is just not for the convenience for these patients. Instead of taking a 4 shots or a 6 shots in a day, now they are taking a pump. The pump gives also an advantage of a basal insulin. The rates can be different in different times of the day, and at the same time they can also take multiple boluses through the pump. But one big advantage with the pump, if you are using sensor augmented pump therapy, the achievement of HbA1c can be like below 7 without getting hypoglycemia, and that is not possible in a type 1 diabetic patients who is only on premixed insulin or on a multiple daily insulin injection, and this will really decrease the complications. We have many patients in our country who are on the pumps and continuous glucose monitoring, which helps our patients. Now, as far as cost effectiveness is concerned, I always tell the cost is always in the complication. If somebody develops nephropathy, somebody develops retinopathy, somebody becomes blind because of that, the quality of life and the cost for treatment of that particular disease, and even after treatment of that disease, still you are not cured because somebody had developed already kidney failure or a complete retinal disease, they may not reverse back. So the cost of treatment of a complication is much more higher than cost of a therapy in a diabetic patients. Now let us talk about the use of technology in type 2 diabetic patients. If you just see many of the diabetic, the physician will feel that type 2 diabetic patients on an oral anti-diabetic agents, they need not require any type of monitoring. But that's not true, because a type 2 diabetic patients, if you put them on a ambulatory glucose profile or a continuous glucose monitoring, it gives you complete glycemic pattern. It also teaches the patient, educates the patient, motivates the patient, and at the same time it also educates the primary care physician that where the patient's sugar is going high. Even sometimes I use it just for the sake of educating the patient that your post breakfast sugar is very high when you take your breakfast in a hotel, when you are traveling for a meeting or anywhere across the world or in India, and you find your post breakfast sugar is very high, because this gives you an idea of 14 days. Or a weekend post 2-hour dinner sugar is very, very high, because in weekends they are taking dinner outside. So a continuous monitoring only gives you the complete picture of the sugar, which is whether in weekdays how it is and how they are behaving in weekends. And this really educates these patients as far as their lifestyle modification is concerned. But not only lifestyle modification, which molecule I have to add, the second line or third line or a fourth line agent which I want to use for my type 2 diabetic patient, it can be also decided with ambulatory glucose profile or a continuous glucose monitoring in type 2 diabetic patients, we don't have a hard and evidence at this point of time, but it improves the glycemic variability, and glycemic variability improvement will definitely decrease the HbA1c. We may not have the hard endpoint that by improving the glycemic variability you are going to have less complication, but yes, definitely by improving the glycemic variability I am going to achieve a good tight glycemic control, and that is going to decrease the complications in type 2 diabetic patient also. Some of the high risk patients, already the renal failure or established cardiovascular disease, where I don't want them to develop any type of hypoglycemia, even a 2%, 3% or a 5%, we may say that glimepiride is not causing so much hypoglycemia, or newer sulfonylurea, they don't cause so much hypoglycemia, or even some of the basal insulin don't cause. But I don't want my patient who is on renal failure or established cardiovascular disease or a heart failure should not develop a hypoglycemia. These are also the patients where a tight glycemic control is needed, but we don't want them to develop hypoglycemia. So these type of patients also need complete glucose profile, either through a continuous glucose monitoring or AGP in our day-to-day clinical practice. We tell our patient to do SMBG, but you tell me how many of our patients are ready to do multiple times pricking their fingers just to check their sugar. So random blood glucose or by doing a self-monitoring blood glucose will not give you a complete profile. That is only possible through a continuous glucose monitoring or by ambulatory glucose profile. Some of our type 2 diabetic patients who are on insulin, they are benefited with the pumps also. There are patients, type 2 diabetic patients develop gestational diabetes or GDM or first time detected type 1 diabetes during pregnancy, also get benefit of pump therapy as well as the sensor. But I say all my physician colleague and all my endocrinologist and diabetologist friends that use of technology in our day-to-day clinical practice will be really very useful, and it will help and improve the glycemic control of our patients and will help us to decrease the complications in our patients also. Thank you very much.